pelvis somewhat tipped backwards into what looks like to be a posterior tilt, and then they're leaning forward with the whole pelvis, and that's the sway part. Because everything's getting thrown forward here, we balance that out by swaying back. My name is Greg Chaplin. I'm a physical therapist and strength conditioning specialist, and in this video I'm going to talk about sway back posture, what's going on from a positional standpoint, what types of exercises can we use to make some gains in the movement department. So if you like this video, make sure you like, comment, subscribe, hit that notification bell so you know when I upload a new video. And without further ado, let's get into the explanation first, and then we'll get right to the exercises. So what is a sway back posture? A sway back posture is when someone is swaying into their hips. This person is typically in a standing position, going to have their pelvis somewhat tipped backwards into what looks like to be a posterior tilt, and then they're leaning forward with the whole pelvis, and that's the sway part. And what they're really doing is they're balancing on the ligaments in the front of the hips here. And so when we look at the position of the pelvis to start out, what we're usually dealing with is this position where both of these bones are coming out a little bit into what we would say is external rotation. So I went into this in a little bit of detail in a video where I was talking, is it an anterior or posterior tilt in a sway back posture? So if you haven't seen that video, that might be useful to you. Essentially, even though we're dealing with a pelvis that's tipped a little bit further back into what would look like a posterior tilt from a muscle activation standpoint, there are some muscles that we want to go after in terms of abdominal obliques and deep abs that are actually going to help to take the pelvis from this position where these ilium bones are externally rotated to more of that internally rotated position. That's going to open up some of the muscles that are tight here in the back of the pelvis. But in the case of a sway back posture, you typically have tightness going here in the back of the pelvis as these bones come together, and then you usually have another level of restriction here on the front side of the pelvis, and the main culprit is typically some of the hip flexors and then also the rectus abdominis or six-pack muscle. So now going to the upper half, up in the rib cage, what we end up getting is, because everything's getting thrown forward here, we balance that out by swaying back through this rib cage. So it's going to actually look something like this. You'll see the bottom is coming forward and then the top starts to curve. And so at this level, like right where the shoulder blade would end, you're going to see this bend and everything in the upper body comes forward, and that's the sway back piece of it. So again, one of the main culprits here is that rectus abdominis pulling down on this sternal bone here, and so you get this down sternum position that we've talked about in the forward head video. So if you haven't seen that one, go ahead and click the link and watch that as well. And then after you get this, and you've swayed back here, typically you'll get another level of compression and some flattening in this upper thoracic spine as well. So those are all the positional things that we have to deal with when we're talking about correcting sway back posture. Now we're going to get into an exercise progression that we can use to start to recapture some movement in the case of a sway back posture. So because we're dealing with compression on the front and back side of both the pelvis and the rib cage, what we want to do first is restore normal breathing mechanics, and then after we have that, then we can get to more of our traditional exercises. So we can do this either in a seated, side lying, or prone lying position, whatever is most comfortable. And what we're essentially looking for is we want to restore, as we inhale, ribs moving out and up, and then as we exhale, ribs moving down together. But maybe more importantly, we're trying to get the sternum to come back up, and we're trying to get some expansion here in the back side of the rib cage as well. So what we can do is we can simply do some seated breathing, and we can grab a band in order to get some of this expansion going here. So I'm going to show you that now. So we're going to take our band, we're going to put the palms up. We can pull out against that band a little bit to get a little bit of tension there. Then we're going to reach forward and down with the elbow so we feel our shoulder blades start to wrap around and some space is created between the spine and the shoulder blades. Now in this position, we're going to keep the sternum somewhat elevated. We're not doing that by trying to increase the arch in our back necessarily, but just maintaining the head up. We're going to gently breathe in through the nose and then out through the mouth with an open, relaxed jaw. Do a couple of sets here, and you want to go as gentle as possible. And then exhale. Now this exercise here is for those people that have that stiff rectus abdominis, this six-pack muscle that they just can't tone down. And so you'll have to progress slowly with this one. But this is going to be a prone press-up activity. It's going to look a little bit like this. For your really swayed back people, they might have a little bit of trouble coming up into a full press position. So for those folks, just even propping up on forearms and having the sternum and rib cage lift up a little bit as they press down with the elbows here, kind of passively elevating that rib cage. That's going to help to lengthen out that rectus abdominis. As you are able to progress, you can push up a little bit more, which is going to help that lengthen out. Okay, but you don't want to push to the point where you feel any discomfort here in the back. And then in this position, you can drive some breathing. As you inhale, that sternum should continue to come swiveling forward, opening up the front side of the rib cage, and then you're going to exhale and try to let that dip down. And that's going to restore a little bit of that spinal extension, if you will, but more what we're looking for here is to get the sternum to come back up and to get the front side of the body to expand. Then once you have that, you can go to the all fours exercises that we'll demonstrate next, and then you can go to the gym. Now, when we're looking at the pelvis, we're going to be trying to achieve a similar dynamic function. So again, we said we were starting here, okay, where this butt was a little bit tight. So we can do some breathing in an all fours position to start to open some of this up, and that would look a little bit like this. So we get into a hands and knees position. Even more effective here would be to drop down so that the elbows are below the butt. This is going to create a little bit of an inversion to help let the upper lungs fill first, which is going to increase that AP expansion in that upper rib cage. In this position, you can again do that gentle inhale through the nose, and then you're going to exhale through the mouth with an open, relaxed jaw. As you're doing this, you're going to passively let the spine come into a little bit of what's probably going to feel like an arch, and you're also going to keep nice and relaxed through the hips. Okay, you might take the feet and turn them out if you can, and that's going to further open the backside of the pelvis there as well. And then you can do some breaths in here and exhale. Now another good progression from here would be something like a rocking type activity. So keeping the weight in the elbows, you could push back, now trying to relax the hips and get some opening again in that back side of the pelvis. And you're also going to relax the front side of the hips here, especially if you're starting to feel that kind of pinchy block happening in the front of your hips. You're going to rock back forward. Okay, try your best to bring the weight into your upper body only, then push back and get a little bit of that opening on the front and back side of the pelvis. So after you have the breathing mechanics somewhat normalized, then we can go to the gym and advance to some further exercises to start to restore rotation in the pelvis and the rib cage here. So let's head to the gym and we'll check a little bit of those out. Okay, so once you restore those normal breathing mechanics, then you're gonna get into the gym and try to restore some rotation in the pelvis and the rib cage. So you're gonna grab a ball, you can go onto your side. You're gonna keep your heels together, and we're gonna work some gentle hip shifting here. So the upper thigh here is gonna roll forward, so the ball rolls forward a little bit, and then it's gonna roll back, so the ball rolls back a bit. And you're gonna go nice and easy here. The idea is almost just to use the ball to somewhat passively move this top thigh. The heels stay together, so you're getting all the rotation right now through the hips and pelvis. Okay, you can pick a phase. It's not gonna matter as much because you're compressed both sides. So you could, let's say, inhale as you go out. You're gonna exhale as you go back. Inhale as you go out. Exhale as you go back. Or you could reverse that, inhaling as you go back. Exhaling as you go out. They're going to bias different sides of the pelvis in terms of what's expanding and compressing, but you're going to do that on both sides as well. So you'd flip over and do this on the other side too. Now to drive some rotation in through the rib cage, we're going to use some alternating reaches from a side lying position, transitioning to rolling, and that's going to look a little bit like this. So you're going to get onto your side. You're going to reach forward with the thumb up as you inhale. You're going to turn the hand first so the thumb comes down. You're going to exhale as you reach back, allowing the shoulder blade to come back, as well as that upper rib cage to turn as well. Then you're going to turn the thumb back up, inhale, reach, you let the shoulder blade come forward, you let the rib cage turn as well. So you can do those alternating reaches. You could even mix these in with those hip shifts so that both the knee and hand are reaching together as you inhale, and then as you exhale, coming back, and that's gonna help get some of the turning to happen in that pelvis and rib cage. Then you can transition to a rolling type activity. So you might wanna start this rolling sequence on your side. What you're gonna do is you're gonna go into that reach, and then you're gonna continue the roll so that you actually end up landing on the front side of your body. So that's gonna look a little bit like this. And then you're gonna come back. You're gonna make this a little bit harder by leaning back towards your back a little bit more. And then you're gonna inhale and reach. You're gonna turn your head over the downside shoulder. And you're going down onto your side there. Then you should be able to go all the way to your back. You're gonna reach up, turn your head over that shoulder that you're reaching towards. And you're gonna drive some rotation, mainly through that upper body, letting the lower body come along for the ride. Once you get that down, you can go onto your front, and you're gonna do the opposite. So you're gonna be looking towards the upside shoulder. You're gonna reach back. You're gonna let that upper body do the work. Then to make it harder, you're gonna go fully on your front. You're gonna reach up and back, turning the head and rolling. Another warm-up activity that might be useful, especially if you've got quite a sway going on at that lower shoulder blade level, is to use a foam roller. So we're gonna put the foam roller right here where that lower shoulder blade would be, and then we're gonna drive some, what folks would think of as spinal extension, thoracic extension, as we lean back over the roller. This is something you wanna be progressive with. So if you got a big sway going on, you might just try to lay flat, but then as you get that sway reduced, you might go to the foam roller, and that might look like this. So you lay on the foam roller, you're gonna roll up until you feel those shoulder blades. You're gonna support the head with your hands, and then you're gonna lean back a little bit from that lower shoulder blade level up. In this position, you can drive some breathing here. As you inhale, you should feel that sternum come up, and that front side of the body open up a little bit, and then you're gonna exhale. You should feel that open up a little bit more. You can do a couple there. Just letting that upper body kind of fall back as you go through the reps. And you might get some nice little cracks in your back as well, and those usually feel pretty good. Once you get those down, you're probably ready to progress to things that are a little bit more upright. So let's go through a couple of things you might do from a lower body and upper body standpoint after you've mastered this rolling in the thorax and the pelvis. Now earlier we talked about the position of the pelvis being somewhat this externally rotated position where we had some restriction here between that sacrum and this ilium bone of the pelvis. So a perfect activity to start to get some expansion here is actually a deadlift, because it's going to bring us into that opposing shape as we shift the hips back. Okay, we're also going to get some expansion in this lower part of the rib cage that we need to, and we're also going to get loading that helps us engage some of the musculature here so that we can stay up and prevent that forward head that goes along with this. So you can perform a deadlift either with an even stance or an offset stance. Because we're trying to improve rotation, an offset stance is often a little bit better in these cases. So what you do is you put one foot behind the other like this. You would hold the kettlebell. You're going to let that hip shift back as you lower the kettlebell down, kind of folding over this hip crease. You're going to have weight heavy in the heel, and then you're going to come back up. You're going to inhale on the way down. You're going to exhale on the way up. You're going to let that weight drop down as you sit back through those hips. So it's an inhale down, it's an exhale up, and you do that on both sides. Now looking from an upper body standpoint, what you might want to do, again, is do something alternating or reciprocal, because we get compression on both sides of that upper rib cage. So in the lower body, again, we're going to go offset with the stance, one foot in front of the other. And then we're going to take this on the side that's back. We're going to inhale first. Then as we pull, we're going to exhale. It's going to drive a little bit of rotation here and a little bit of rotation down low. So we're going to inhale as we let this come back, and then we're going to exhale as we go back. Then we can switch this activity around. So we're doing more of a press. We're again going to go into that offset position. Going to be a little bit more heavy here. Then we're going to inhale and exhale as we reach. Going to inhale back and exhale as we reach. And again, that's gonna get some turning going in that upper rib cage. If we wanna get even a little bit more turning as we're progressing, then we can take that opposite side hand and reach back as we reach forward here. And that's gonna turn that whole rib cage, in this case, towards that front side leg to the left. So it's gonna be an inhale and then an exhale as we reach, now reaching back as well with that back side hand. We're gonna inhale back, we're gonna exhale as we reach, we're gonna keep that head and neck upright, and we're gonna drive some of that rotation at the pelvis and at the rib cage. Now, if we wanna progress from this, if we're doing really well, we can go to something that's a little bit more towards a split stance type activity. So we're gonna get that back toe heavy, front heel heavy. We're gonna dip down and then back up. We're inhaling down, exhaling up. Now, if we get that split stance down, we can go into a semi-split stance and then integrate the upper body here as well. So we're gonna breathe in and then exhale as we pull. Breathe in to return, exhale as we pull. Now we can take this other hand in as well. So we're gonna inhale, reaching back, exhale as we pull, and reaching forward to drive a little bit more rotation through the hips and the thorax. Thanks a lot for watching today's video. If you like this video, make sure you like, comment, subscribe, share it with someone if you think this can help them. And if you have any questions, leave them below in the comments. Until the next video, thanks a lot for watching, and hopefully we'll see you in the next video. Peace.